Postpartum depression is a collection of symptoms that women would experience in the first year of postpartum. It can happen at any time during the first year. And usually women will describe a change in mood. So that might be sadness and crying, it might be intense irritability, but there will be like a significant change in mood that's there for much of most days. There can also be like a lack of interest or enjoyment in things that would normally bring joy or interest. Some women will find that they have difficulties connecting with their babies as a part of that. And then there's other symptoms like insomnia, changes to appetite, feelings of hopelessness, feelings of guilt, suicidal thoughts. So when there's a collection of these symptoms present for a couple of weeks or more, then that would often mean that somebody's meeting the criteria for postpartum depression. One of the most significant risk factors is if a woman has experienced depression at any other time in her life, then she is at greater risk for postpartum depression. Other risk factors that are important are a lack of social support, feelings of sort of isolation. Also, when women feel sort of like disappointed or not well supported in their partner relational or marriage, then that can also be a risk factor. Sleep deprivation is another risk factor, and difficult infant temperament is another one. And then other stressors. So if women are navigating pregnancy and postpartum and other stressors in their life, then that adds a level of risk for depression and anxiety as well. Yeah, well, the research varies a little on that, but roughly 13% to 20% of women will experience postpartum depression, and anxiety is like just as common, if not even more prevalent than postpartum depression. Well, self-care is a really helpful approach. So especially for symptoms that are mild or moderate in nature, good self-care can make a difference. So this is things like making sure there's good nourishment and hydration and some exercise and rest and relaxation, which usually requires asking for help. So that's where that network of social support comes in, because women often need some help with baby care in order to be able to rest and relax and look after themselves. So self-care is important, and then connecting with healthcare professionals can also be important when symptoms are increasing to moderate or, of course, severe. Then your physician, urgent services, counselors, and there's also some peer support available for depression and anxiety in pregnancy and postpartum that can be helpful for women. There's a nonprofit organization in Calgary called Families Matter, and they offer peer support for postpartum depression, and they also have like a support group for women experiencing postpartum depression and some peer support resources over the phone as well, I believe. Well, we offer individual counseling, and we also offer couples counseling. And so many individuals and couples do come for counseling during times of significant transition in their lives, which can be pregnancy and also postpartum. And so we're certainly here to help women and their families during these transitions. I hope that women who experience symptoms of depression or anxiety in pregnancy or postpartum, my hope is that they access support, professional, personal resources sooner rather than later, so that whatever work needs to be done to help get them feeling better can be sort of most effective and efficient when the process is started earlier on rather than later on. And my other hope for women is that they recognize that the better cared for they are as individuals, the better prepared they'll be to meet the demands of pregnancy and labor and delivery and postpartum. And so my hope is that women will ask for the help they need and receive it from their support